And I had strange experiences. Like I was the doc for a really wonderful guy who he and his wife split time between and Hawaii, which a lot of people do, and especially in the neighbor islands. And this guy, he developed lung cancer, and it's pretty tragic. But he was older, and he knew he was going to die. It was inoperable, so he, he let me take care of him at home basically. So I did a lot of house calls, and money has never been an important thing to me per se. Just paying back my loans. In fact, I had loan repayment from the federal government, so I didn't have that issue. So I'd do house calls and see him, and they would always give me food, and I'd hang out with his wife, who was a little younger, and he was struggling. So I made sure he didn't have any pain, and I brought medicines to him and oxygen and so on. But right before he died, and when you practice, you know when someone's going to pass away pretty closely, and he certainly knew. And he said, "Okay, doc, this is the last time I'm going to see you." And I knew he was right, because I was seeing him weekly. But I got something for you in the car. Just don't shoot anybody. And he had given me a boat and a spear gun to take as a present, which was unbelievable. Unbelievable. And that's, so he put this kayak, loaded it up onto my Jeep. He had his nephew do it, I guess, and there was a spear gun sitting in the seat, the passenger seat in my Jeep. And that's the kind of experience that you just don't get a lot of places. I mean, look, I'm not saying everyone should come get a job in Hawaii so they get a spear gun and a kayak, right? But the idea of taking care of a patient and being able to really know him and his wife, and to actually have that kind of rewarding experience is probably unmatched in most places, in most other states, in most other cities. So I think there's a lot of really unique, great things about Hawaii, and great reasons to come and be a doctor here. Uh, I would say people should come and experience it. It's not for everybody. In my experience, people that come from the mainland, if they don't have any roots here, sometime around a year and a half, they figure out whether it's for them or it's not, and that's okay. Come and experience it. See what's right for you. Come with a family member or a significant other, preferably. If you're already in your career and you're starting an intense job, I think that makes it a lot easier. But I came just with a suitcase, and I went and worked in the rural area of Hawaii, and it turned out to suit me. So I was really, I was really lucky. It won't be the case for everyone, but we're here welcoming new docs, so it's kind of a good, it's a good time to be a physician coming to Hawaii.